In this presentation, we'll look at a windshield survey conducted in Cool Ridge, West Virginia. First, we'll take a look at community health and community health nursing. The concepts related to public health are evident throughout history as provisions were made to care for the poor or displaced. Advances in knowledge about health led to appropriate education of providers and regulation of water and other environmental factors. The most basic definition of a community is a specific population or group of people living in the same geographic area under similar regulations and having common values, interests, and needs. Community health nursing is a population focused approach to planning, delivering, and evaluating nursing care. The goals of community health nursing are to promote, preserve, and maintain the health of populations by the delivery of health services to individuals, families, and groups in order to influence the community health. Nursing theory provides the basis of care of the community and family. They have developed sound principles to guide nurses in providing high quality care. In Nightingale's environmental theory, she highlights the relationship between the individual's environment and health, depicts health as a continuum, and emphasizes preventative care. The theory focuses on taking care of the patient's environment in order to reach health goals and cure illnesses. She believed that the environment has a great role in providing safe care and prompt recovery. Local, state, and federal lawmakers rely on healthcare policies to protect and promote public health. On the federal level, elected and appointed officials write healthcare policy with input from their professionals. The legislative branch formulates the policy. The executive branch approves or vetoes the legislation, and the judicial branch interprets the policy. On the smallest scale, local hospitals and clinics create healthcare policy for their exclusive use only. The three stages of change, as identified by Kirk Lewin, are unfreezing, moving, and refreezing. Unfreezing is recognizing the need for change. Moving is change is then initiated after a careful process of planning, and then refreezing is when change becomes operational. For example, someone who takes good health for granted may fail to develop healthy lifestyle practices until illness results in the recognition of the need for change. This is unfreezing. A careful process of consultation and study may lead to the development of a well developed fitness plan. This is moving, which ideally becomes a part of the person's everyday life, known as refreezing. The community health nurse must consider these three stages of change when considering reasons someone would stop smoking. First, the nurse must help the individual recognize that there is a need for change. I live in Cool Ridge in Raleigh County, West Virginia. I was able to identify several red flag areas that are potential challenges to health in Raleigh County. These included adult smoking, adult obesity, teen births, preventable hospital stays, high school completion, unemployment, income inequality, violent crime, and injury deaths. For this exercise, I have chosen adult smoking, obesity, and high school completion to discuss. I feel like there is a direct correlation between these topics. West Virginia in general is associated with a higher prevalence of low income areas, which are prone to poverty, poor lifestyle choices, and being undereducated. all of which correlate to a higher instance of adult smoking, obesity, and not finishing high school or high school dropouts. I have identified that education level is associated with smoking status, exercise habits, as well as better physical health, such as lower rates of diabetes and improved self reported health. Boys and Girls Clubs of America had its beginnings in 1860 in Hartford, Connecticut. With charter development as the cornerstone of the experience, the club focused on capturing boys' interest, improving their behavior, and increasing their person exceptions and goals. Today, Boys and Girls Clubs provide a safe haven for more than 4 million youth, giving them an opportunity to discover their great futures. The club has many resources and education programs for all ages as well. Participants in the Project Learn program reported 87% fewer missed school days when compared with non club youth. The environmental factors that affect health, as identified in this theory of Nightingale's environmental theory, are fresh air, pure water, sufficient food supplies, efficient drainage, cleanliness of the patient and environment, and light. Individuals who believe that the environment can be mastered to affect health status will actively engage in health promotion, disease prevention, and treatment. The nurse can use it to organize programs such as to educate groups to reduce environmental hazards, advocate for safe air and water, and advocate for waste reduction and effective waste management. The community health nurse actively helps people to change their lifestyles in order to move toward a state of optimal health. We recognize that during our red flag assessment, we found that education levels were directly related to health, to smoking status, and obesity in adults. Our windshield survey found that Coolidge is located approximately 3.5 miles from Shady Springs with a population of 1,605. The area covered is about 31 square miles. Most of this area is rural and farmland. I live in Boyd Crawford subdivision where most homes are modular or double wide. There are two larger subdivisions nearby, one at Flattop Lake in Gent and another at Ridgewood subdivision in Coolidge. The homes are well maintained. No garbage was noted in most areas. However, there are a couple yards with broken down vehicles in them. Closest recreation areas could be found at local grade schools, Shady Spring Elementary and Gent Elementary. Both are fenced in areas, well maintained, and appeared safe and well lit. Both were being utilized by local families, as there are swing sets, slides, and other playground equipments in those areas. I did not find any hangout areas noted in our neighborhood. The closest gathering place could be found at Little Beaver State Park, just a few miles away. However, there are three Dollar General stores within a 5 mile radius, with one being within the limits of Coolidge. There's also a Quick Check convenience store, both of which are accessible by car. There are two bars or breweries that sell alcohol nearby. The Coolidge Service Center is our local garage that services vehicles. The closest medical clinic is located in Shady Spring, a few miles away. There are approximately 8 churches in the area, most of which are Baptist in denomination, and there are 2 Trump flags in neighbors' yards, but mostly the neighbors keep their political views to themselves. Because education is so closely linked to smoking status, it is the community health nurse's responsibility to advocate for programs in the communities. Establishing a Boys and Girls Club begins with a desire to enhance the lives of young people in the community. Starting a new club appears to be a lengthy process with many steps. After you gather support from the community, someone would need to contact the closest service center to learn how to partner with the club. I was unable to find out exactly how long the process would take. However, it would appear that it could take months or as much as a year. Although setting up the club could take a major investment in the community, I believe it would have a very positive impact on not only the youth, but also the adults in the community, many of whom have never had the opportunity to go to college and do not know what resources are available. These programs are designed to ensure that all club members graduate from high school on time, are ready for post secondary education, and a 21st century career. Social policies are usually concerned with the way society meet human needs for security, education, work, health, and well-being. Although social and economic policies are not considered part of health services infrastructure, such policies may influence health and disease by altering social determinants of health. Health outcomes are influenced by the many factors that influence health, from the quality of medical care received to the availability of good jobs, clean water, and affordable housing. If I were to get involved with community health policy, I would start with a windshield survey or assessment of the community, making note of current condition, resources available, and identifying possible barriers to the community gaining access to healthcare resources. I would speak with members of the community as well as other stakeholders for their input. I would meet with public officials, leaders in the community, and the local Department of Health and Human Services about existing public health programs as well. People tend to learn in 3 domains: cognitive, psychomotor, and affective. Cognitive learning involves storing and recalling new knowledge in the brain, while learning a physical skill involving the integration of mental and muscular activity is called psychomotor learning, and affective learning includes changes in attitudes, values, and feelings. The community health nurse will need to appeal to each of these modes of learning in order to bring about behavioral changes in the community. This class has shown me that there are many more opportunities for me as a nurse than just working in the hospital. It has taught me how community nursing is involved in health promotion and disease prevention, that they may manage acute or chronic conditions. To a community nurse, the patient may be an individual, family, or a whole group of people. How population focused nursing includes assessing to determine needs, intervening to protect and promote health, and preventing disease within a specific population. For example, this could include those who are at risk for hypertension, individuals without health insurance, or individuals with a specific knowledge deficit. It is the community nurse's responsibility to advocate for these types of patients and populations and maintain their respect for autonomy and beneficence as well. Nursing is an essential practice all over the world. Europe's healthcare system looks similar to the one in the United States. However, many European countries have implemented a universal healthcare system in which care is free of charge for the patient and subsidized by the federal government. Patients tend to enjoy greater access to care across Europe without worrying about racking up exorbitant healthcare bills. This is definitely not the case in the United States, where particular diagnoses could potentially bankrupt a family or worse. And this has been my presentation. I hope you enjoyed it.